Welcome back. Last week we talked about what are some of the common pains at the elbow and what we need to consider about at the shoulder to help with some of the elbow pain. We're going to move now down to the wrist and talk about what are some issues with the wrist. There are many types of pains at the wrist. One of the common things is if you have a fall and you break your wrist. That's a separate issue altogether, but let's say we're talking about pain that just shows up at the wrist. Sometimes we'll feel it at the back side of the wrist if you're doing a lot of pushing motions, or sometimes at the base of the thumb, or even some carpal tunnel issues. We're going to talk not necessarily about the carpal tunnel today, but we're going to talk about some of just the wrist achiness that we're often diagnosed with arthritis. So what happens in a case where you have wrist pain that just shows up, or it feels like it's been chronic for a long period of time? Well, in our wrist, we have many bones that make up our wrist joint. There's 2 rows of carpal bones that make up that joint, and there are tendons that go across those bones, and the muscles that are attached to those tendons are in your forearm, both on the front side and the back side. When we move our fingers or our wrist, those tendons are crossing right over those wrist bones. Commonly, I find that the muscles here in the forearm are very tight and rigid. They don't know how to relax and they're not supple. Anyone who has wrist pain, when they come to see me, one of the first things I look at is how tense is that forearm? Can I lift up the muscles? Is it supple? Is it mobile? And when I do that, what happens at the wrist and the fingers? If I see a person's relaxed, but their hand is rigid, I know that these muscles really tense. Another thing I'll do is when I teach them how to breathe differently, I'll watch, and a lot of times if someone is used to having a lot of tension in their forearms and use that for most of their daily activities, when they exhale, they'll clench their fingers and it clenches their wrist. And what happens is if these muscles contract, they're pulling on the tendons and it's basically jamming everything in your wrist and the wrist bones. So how to fix that? These are more the basic principles. Sometimes there are a lot of compensations and it goes all the way up to the shoulder as well. But one thing you can start with is looking at the forearm muscles, and if you can massage it as you're practicing some of the breathing exercises that I've taught on my website and I have videos for, see if that can help get you going. If the pain is still there, it doesn't mean that's just arthritis and that you have a problem and you need surgery. It could be that there's a lot of compensations up higher and your shoulder position can affect you, your chest position can affect you, and even your shoulder blade. All of these areas, just like I talked about with the elbow, these areas can affect the wrist all the way down, even into the fingertips. So these are some ideas to consider and look at, and if you have a healthcare provider, please talk to them about these options. But there are also more ways that you can have compensations that affect your wrist, so you need to consider all of these. Again, if you have more questions, please don't hesitate to contact me at amy@paberinstitute.com. Thanks for watching. Bye.